Okay, we're going to quickly go through Chapter 14, AP Psychology Review on Abnormal Psychology. Let's get going with defining disorders. Abnormal disorders are considered a significant disturbance in thought, behavior, or emotion. So, to be considered a disorder, one must have significant disturbance in thought, behavior, and emotion. And it's usually maladaptive, which means it interferes with day-to-day life. Now, some disorders are not maladaptive, and so you might say that they are not a disorder. They may still be characterized as a disorder, they just might not be maladaptive, interfering with your day-to-day life. Some approaches to abnormal psychology. The biological approach. The biological approach is the biomedical approach. It uses the medical model to understand the brain and to treat with medication or hospitalization. So it uses the medical model to understand the brain, and it's treated usually with medication or hospitalization. The psychodynamic approach seeks to uncover the unconscious, how internal conflicts motivate behavior. This is often referring to childhood. We know that from the psychodynamic perspective. So it's looking at the unconscious and how internal conflicts motivate behavior. The cognitive approach is the perception of how we think and how we believe others think of us. Remember, perception and reality might not be the same, but it's hard to tell the difference sometimes. So the cognitive approach is the perception of how we think and how we believe others think of us. The sociocultural approach. Cultural circumstances can influence or cause abnormal behavior. Cultural circumstances influence or cause abnormal behavior. The behavioral approach is only looking at observable current behavior. They really don't care what's happened in the past. They really don't think how you feel others are viewing you. They're only concerned about observable current behavior. The DSM-5. There's been 5 revisions of it. It's the Diagnostic and Statistical Manual of Mental Disorders. Diagnostic and Statistical Manual of Mental Disorders. This will be referred to a lot, and how disorders are going to be categorized and the criteria for those disorders. Some of the big criteria is time, symptoms, and age. So time, how long has the patient been struggling with it? The symptoms, are they meeting the number of symptoms to be defined as a disorder? And sometimes age in certain cases. Gender can somewhat be a factor, and in other parts we'll talk about how gender is more of a factor. Comorbidity is a co-occurrence of 2 or more disorders or diseases. The co-occurrence of 2 or more disorders or diseases. This is when you need to be a really good practitioner and find out a good detailed history and understand what can be conflicting with another part. For instance, diabetes and depression we talked about. Rosenhan's study and stigma. This was talking about diagnostic labels. He did an experiment in an institution that shows that patients can carry a stigma even after their recovery to normalcy. After recovery or normalcy. And so Rosenhan had himself admitted to a psychiatric ward. Then he did not display any symptoms of being abnormal behavior, and he continued to carry that stigma all through his time in the institution. Anxiety disorders. GAD, general anxiety disorder, is characterized by being jittery, agitated, having sleeping problems. It's very hard to pinpoint because it is so broad, because it is so general. It's often women, typically at a younger age, who don't handle stress very well. And so they are showing these signs, and it can be very, very anxious for people with it. Panic disorder. This is unpredictable. You have a shortness of breath. You have a feeling of choking. This is dizzy. It's usually a more brief, whereas general anxiety disorder, you don't have these big panic tornadoes. Panic disorder is bad, but for a smaller, more brief amount of time. Phobias are irrational fears. Usually it's of a specific phobia to an object or a situation. A few that I want you to know: social anxiety disorder. This is extreme shyness and the fear of being humiliated in public. Agoraphobia is a fear of public places and crowded situations. When we talk about other anxiety disorders, we talk about PTSD, post-traumatic stress disorder. This is often brought about by abuse or tragic events. Natural disasters even can lead to depression, other phobias, anxiety. Oftentimes it's characterized by nightmares and flashbacks. But we see in post-traumatic growth, we see in many people, post-traumatic growth shows that survivor resiliency, that not everybody who experiences this will suffer with PTSD. And which is good, because we can about imagine anybody who experiences devastating trauma shouldn't have to live with this. And so there is good survivor resiliency. OCD, obsessive compulsive disorder, is unwanted repetitive thoughts, which are obsessions, and actions, which are compulsions. Feeling the need to do something over and over and over again, that's a compulsion. Having these unwanted thoughts that continually come into your mind, thinking maybe you have to do these actions, that's the obsession. Mood disorders. Depression is the leading cause of mental illness treatment in the United States. Now, as we said, it's not as common as phobias, but it is more treated, at least in the United States, and that's going back to the sociocultural approach. Perhaps we're better at diagnosing it than other countries. Seligman talks about learned helplessness. This is in serious depression, especially when people believe that nothing is going to help them or make a difference. They have a lack of motivation, cognitive deficits, emotional deficits, where they just feel helpless and hopeless. SSRIs are usually what are prescribed to help. If we talk about the biological model, antidepressants that block the reuptake of serotonin in the synapse. You should remember that. SSRI stands for selective serotonin reuptake inhibitor. Probably the most common are Prozac and Paxil, but there's many medications out there. Major depressive disorder. To be characterized with it, you have to have symptoms for at least 2 weeks. There we get into the time that the DSM is going to talk about. You need to have a depressed mood for most of the time, difficulty in sleeping, a loss of energy, a loss of appetite or change in an appetite. You need to exhibit these symptoms for only a short period of time, but quite a few of them all at once, which is why it's considered a major depressive disorder. Bipolar disorder. This is when people range from a seriously depressed or severe depression to wildly manic hyperactive, optimistic state. So they range from severely depressed to severely manic. And during these times, they have these ups and downs of behavior. Personality disorders. Personality disorders mostly impairs our social functioning. It really interferes with people's social functioning. That's the best way to put it. Especially something like DID. And this is when you have multiple personalities that are separated from each other. It's probably quite controversial because, as we talked in class, is it a good way to escape and repress the trauma that you have not properly dealt with? But oftentimes people in DID are in a fugue state. They cannot remember the past or events. They're suffering with amnesia. And that's usually because of emotional trauma. Antisocial personality disorder is characterized by a lack of conscience, I should say, regret. They're very aggressive. They can be clever, often con men. And that should be also noted, that usually antisocial personality disorder is by men. Histrionic personality disorder. People are very impulsive. They have dramatic behavior. They want to be the center of attention. Sometimes we can look at bipolar and histrionic and see some of the similarities in the manic state. So it's good to know, are they having these ranges like in bipolar, or is this kind of this pattern of personality where they're doing things extremely dramatic in order to get attention. Schizophrenia. The word means split person. It's a split from reality. And remember, this is a brain disease, which is why we categorize it differently than the others. Some characteristics of schizophrenia. These you must absolutely know. Flat affect and catatonia. These are both negative characteristics. Hallucinations and delusions. Hallucinations are false perceptions. Delusions are false beliefs. These are positive characteristics. Oftentimes inappropriate behavior, disorganized speech, we call that word salad, all characterize schizophrenia. Do know that acute schizophrenia, acute onset, means it's acute, is happening quickly, it's happening fast. Chronic schizophrenia is much slower in progression, and that has a less likely chance of recovering to a sense of normalcy. We know that we don't know a ton about schizophrenia, but we know some, and there's a big biological key. And we know that there's excess dopamine receptors that cause the psychosis, these symptoms like hallucinations and delusions and paranoia. And ADHD. This is a neurobehavioral disorder, often diagnosed in children, sometimes mistakenly, because children are prone to hyperactiveness and impulsiveness. But there's a deficit, and it's considered a disorder. Again, typically because of maturity, and often treated with medication. Children tend to learn how to deal with it as they get to be adults, and then oftentimes it's just known as attention deficit disorder. So that's it. That's the test for tomorrow. I hope you have studied. Good luck and see you then.